Okay, we've hooked up to the middle hinge, and just like you saw in the earlier pictures and videos, so we're going to be working on here, here, and here, and we're going to start with an isometric push. So what you're doing is you're going to pull the rope or however many bands that you want to put inside your system right here. And so you go ahead and pull your knee back and relax a little bit, and now you're going to push into the band and hold. So you're going to hold this for 30 to 60 seconds, and you should be feeling it right in here. You're going to keep your lower back on the ground, and we're going to try to stay at a 90 degree, like as if you're sitting in a chair. And so do this for 30, 60 seconds, and you're going to hold it. And basically what you're doing is you're just doing an isometric hold, and you're waking everything up, and it feels good, really, really good in your hip, your quads, and right here in your knee, ankle, and you're getting everything right in line. It's nice and healthy. After I do that for 30, 60, 90 seconds, whatever's comfortable for you, I relax, and then I go ahead and just kind of loosen up the joints from my knee, my ankle, my hip, and that way before I'm getting ready to do any kind of activity, sport, work, or if you're doing physical therapy, or if you're elderly, this is great for the bedroom for elderly patients or people that just are not functioning well physically in life. So they can be doing a little bit of this to start getting them back up on their feet. But for you, you're going to feel good once you've done a lot of these different types of movements and stretches. So you're doing the isometric hold. So now do 2 sets of the isometric hold of the way I just described, pushing into it. The next thing you're going to do is we're just going to do little mini squats, I guess you could call it, and we're going to do about 15 to 20 reps. And so you have to hold the rope, pull your knee back just past 90 degrees here, and then I push into it, and we're just doing about 6 to 12 inches pushes and hold there, nice and slow, trying to get that movement, and we're keeping our knee right in line. And so you're basically getting all those different areas. So if you're having sciatica, or if you're having pain in your hip, having pain in your knee, this is good because you got the different bands here that you can choose from, the yellow, red, black. I'm using all three for a little bit more difficulty. And if I want it to be a little bit harder, I can just pull the rope a little bit, and I don't have to move or anything. I can control the resistance and the push. So as we described in PNF with physical therapy, you have the physical therapist that's going to push into the foot and make you hold it here for an isometric hold. You don't need the physical therapist because that's what we're doing right here in this situation. Okay, so it's isometric hold. We're going to do repetitions of however many reps you want to do, 15. Relax. We're going to go ahead and stretch out that hip, stretch out the knee, stretch out your hamstring. And so this is what we're doing for just this one movement. The next thing we're going to do, continuing with working on your glute and your quad, knee, ankle, and everything, we're going to go ahead and move your knee to the outside. Okay, so we're going to do the same thing, moving the knee to the outside. You're going to pull it up. You're going to push into the band. Oh, it feels so good because now I'm getting that inner groin area, plus I'm getting my glutes as well. I'm doing an isometric hold, holding the rope. I don't let go. I push into the bands, and I hold for 15 to 30 seconds. I do a count until I get to that point. But just for this video purposes, I'm just describing how you should be doing this routine. So your legs to the outside, you release, go ahead and get some nice big round stretches and circular movements. And it feels so, I'm telling you, you're gonna feel so good after you're doing the isometric holds, then doing the resistance, and then doing nice loose training and just doing range of motion like you can see me doing. And you can do whatever feels better for you and how you're holding your leg and your foot. But I'm just getting all this range of motion. I'm loosening up that whole entire hip girdle so that I can move on to my next movement, which is now the same thing I did before. Knee to the outside, create the amount of resistance you want with the pulling of the rope or the bands. And now same thing, I'm just gonna hold, and I'm gonna do little mini pushes of 6 to 12 inches. You don't want to extend too far. You just want to go 6 to 12 inches, hold it in position. You can do it faster. So if you're trying to work on those fast fast twitch muscles, or if you just want to get it to the outside to about 30 reps, whatever you feel comfortable with. And sometimes it's better to start off with a smaller band when you're doing that, and I'll demonstrate that in a second. But once I've done to the middle, to the outside, I come back across, same thing. You're keeping it at a 90 degree as if you were sitting in a chair. Come across, so it's kind of like an iliotibial. So I'm going across like this, and I'm feeling it all up in here. And you may feel it, everybody feels it in different places sometimes, because that's probably where you're tight or you're having pain. And I'll just come across and I'll hold it there, and I'll do 30 to 60 seconds in this situation. I'll do the mini repetitions. I'll loosen up the rope. I'll come back, and I just kind of do nice different movements where I can just do range of motion. I can create resistance in the range of motion as I'm doing this, or I can just do what I'm doing right here, just nice and relaxed and just enjoying how I'm doing this, so that I can just loosen everything up. And that's it for this particular video, is just doing a laying on your back, sitting down, isometric holds to the inside, outside, and across your body. And that's it. The first thing we're going to do here is we're going to take the anchor strap off of the airtime stretching system. Disconnected here. So I disconnected the anchor strap and I set it up on the bed, as you can see here.